Welcome to our 5 on 5. We're pleased to welcome back State Senator Dr. Alan Bates. Alan, good to see you again. How are you today?
Thanks for having me, Craig.
All right. So last week we had the chance to catch up with Sal Esquivel,
Okay.
your friend Peter Buckley. Just talking about him. But Sal was not happy with the way things went in the House with the bipartisanship in the last session. How was it like in the Senate? What did you think?
It was pretty rugged. We weren't as bipartisan as we should have been and could have been. It was filibuster most of the session, slowed things down, ended up getting everything done in the long run anyway. But personal relationships broke down. There was a lot of anger and a lot of pushing and shoving. We're going to have to work hard to get over that. But I'll give you an example of it doesn't have to be the way. Representative Stark from Grants Pass wanted to push through a couple of bills about zoning for small and medium-sized cities, wanted a pilot project for it. He worked hard on it, put a great bill together. We passed that through both houses. It doesn't have to be partisan. It can be bipartisan. And people like Dwayne Stark and others, I hope myself, can get there. And on suction dredge mining, as an example, I pulled back on that because we didn't have bipartisan support for it. Wanted to work on it some more. That's the kind of thing that leads to the best legislation. But sometimes you got to do things. You got to put something through. Minimum wage is a good example of that. There were 2 ballot measures ready to go in November. One for $13.50 immediately. One for $15 statewide immediately. We felt that was going to be something that was going to hurt our economy, so we thought it was appropriate to respond to that, and we did it in a 3-tiered system, gradually and slowly raising those minimum wages up. You know, minimum wage when I was, a young guy back in the 60s, I was getting $1.25 an hour, but that's $11 an hour right now. So we're still below where we were in the 60s. And I think what people don't understand that are in politics with me, these initiatives, the $13, $15, $15, pulled off the charts. We never saw anything like this before in our entire careers. These were going to pass. $13.50 for sure, $15 maybe. If you think you got a problem in putting $13.50 in, think what $15 minimum wage would have been like for cities and counties and businessmen. So we made it very gradual over the next 5 years, bringing it up to a more reasonable level, and those ballot measures got pulled.
Okay, so one of the things I wanted to ask you about minimum wage, obviously that was the big thing from the session, is Lynn County commissioners are considering a lawsuit over the minimum wage, calling it an unfunded mandate. And one commissioner was quoted, I think the Register Guard said, as many as 6 counties have already reached out to them about this. What do you have to say about calling that an unfunded mandate? I
think that they don't realize what's really going on. They're out of touch with the population they're serving. They're out of touch with the public. If we pulled this back right now, that $13.50 or $15 would be out there on the ballot and will pass. They're looking at about a 50-cent increase in minimum wage each year for the next 5 years, roughly that amount. Have them take on $13.50 an hour immediately from $9.50 now. That would just really bust some of their budgets.
Okay, so what about a cure for hepatitis C? I understand we have one, but many can't afford it. It's very expensive. We have viewers who want to know about this and when that's going to change and how that's going to happen.
First off, it's kind of a miracle that we have a cure for hepatitis C. It's an absolute breakthrough in healthcare. Hepatitis C is induced by direct blood-to-blood contact through transfusions, surgeries, and illicit drug use. And it's a killer. But you don't know which patient's going to die from it. Some very small number of patients get liver cancer from it and die, and the ones that get in most trouble are the ones that get cirrhosis of the liver, and as that cirrhosis progresses, that kills them. Mm-hmm. The drugs we have, Sovaldi and a new one coming out, absolutely cure the disease and do it very easily. It's a pill a day for anywhere from 6 weeks to 3 months. Wow. It's just amazing, okay? The problem is the cost. The average cost for treatment for one case of hepatitis C is $100,000. Now that's in the United States. Other countries, it's a fraction of that. Basically what happens in America is that because we don't control drug prices, we are basically supporting the rest of the world on the cost of this drug. The other countries, you can get it for $1 a day.
So how do our viewers go about enacting change there? Is there anything they can do?
The change that needs to happen is that price needs to come down. It's immoral for us to have to pay those kind of drug prices and for people to have to wait for treatment and risk their lives waiting for that treatment. This has to be handled at the federal level. The state of Oregon does not have the authority to change this. At the federal level, they can step in and tell the manufacturer of this drug, you're either going to change what you're doing, or we're going to allow another drug company to come in at a lower price. Or they can just put political pressure on them. They've just got to do it. So people should contact their legislators at the federal level, congressmen and senators. Senator Wyden is actually working on this issue, trying to get that price down to something reasonable. And if he can do that, it'll be better for all of us. The new drug that just came on board is about 40% less expensive, but it's still $50,000, okay?
Yeah.
And it can't be used for all types of hepatitis C. There's 4 genotypes. It can only be used for 2 of them right now. It may be opened up to be used for others too. But contact your people at the federal level, and we'll keep pushing at our level. We'll keep pushing them too.
Okay, very good. Good to see you. Thanks so much for being here. Appreciate it.
Thank you.
All right, stay with us. We'll be right back.